It's pretty exciting to see how the AI tailwinds are starting to take along companies that have been around for a while. You know, Avo is now on its 7th year, and we've been delivering these kinds of services for a while. Now that people are starting to talk about AI summarization from the charts, AI scribe, the tailwinds are really bringing us and other companies forward because finally health systems recognize the need for it. Hey, I'm Yair Saperstein. I am CEO and co-founder of Avo, and I'm also an informatician and an internal medicine doc by background. In 2018, when I was in residency, what I wanted to do was to be able to make it home to my family in time for dinner. I'm also an open water swimmer, so I wanted to be able to make it out to the ocean. I was working in the Brooklyn VA, and Coney Island Beach was right there, and very tantalizing as the sun would set and I was still in the hospital and couldn't make it out to the ocean. And so I wanted to be efficient, but I also wanted to be a good clinician, a good doc. I wanted to be effective. So how did I get efficiency and effectivity together with clinical decision support systems that were oftentimes wrong, and I learned to ignore these alerts, or just the efficiency, but the efficiency was out of the EHR and ignored whatever was in there? And the answer is Avo. So I started putting together this ability to really combine EHR data with guideline data, first as smart pathways that can autofill, and then is an AI scribe, an AI chart summarization, and an AI consult. And now Avo is able to deliver those in addition to providing specific content, for example, utilization management, like if I am going to be discharged, can I help predict if the patient, if I'm discharging a patient, can the patient be discharged or not? So we're able to do some of that work and producing documentation and producing orders. We're now working inside of Epic, Athena, Meditech, and starting to really expand out. We have other EHRs too, Juno, and some others. And so as we're expanding out to not just the large academic systems, but also the middle markets, such as Meditech and Athena, it's a really exciting time for Avo. It's pretty exciting to see how the AI tailwinds are starting to take along companies that have been around for a while. You know, Avo is now on its 7th year, and we've been delivering these kinds of services for a while. Now that people are starting to talk about AI summarization from the charts, AI scribe, the tailwinds are really bringing us and other companies forward because finally health systems recognize the need for it. They want to be able to reduce burnout and utilize AI and other similar tools to be able to do that. So we started the product in 2018. We all went full-time in 2020. That's when we really launched. And you know, when we started, it was really about being a smart pathway. It's like, how can you auto-populate from the patient data against an algorithmic decision tree to be able to auto-produce orders, auto-produce notes, and then have an analytics platform that gives the system how are the providers, how are the clinicians actually using it. And we were really blessed to build that smart pathway system using a builder. And the builder is a no-code, drag-and-drop construction tool. The reason why we're so blessed is because we then put in other emerging technologies into that builder to create new products. And so it's very easy for us to then come out with an AI chart review, which also functions directly inside of Epic and Meditech and Athena and Juno in a way that can look at the patient data, populate the summarization, do decision support, do billing elements like CDI, right? And each of these different products is really based on having that builder function. I have always been about work-life integration. You know, when you are at a conference and you can bring your baby, that is the best. When you're in the hospital, you're always thinking about your family at home, and that separation makes it a little bit harder. And so having a baby really put into perspective for me, now she's 9 months old, the need to have life as part of all the work that you do. I think there's a lot of moving parts at what's happening at the federal level, and we're watching, right? So some of the AI regulation, for example, the oversight has gone down. You know, most recently it just came out that a lot of people within the FDA AI division have been let go. And so part of it is this all going to end up back on the states? And if it's going to end up back on the states, we all need to pay attention to, you know, as we're going state by state, what are the regulations as they'll continue to come out. Right now, it's still a little bit of a gray zone, but the way that Avo sets ourselves up is that we have checks in the back end to make sure that the hallucination rate is low, that it's complete, so that bias is low, etc. And then we continue to monitor as it's actually out in clinical practice to make sure that it's continuing to do well. We also have source tracing so that if the user wants to be able to see, where did this data come from in the EHR, they could see it, or where does the information come from in the guidelines, they're able to check it. The last thing that we do is we actually have a combination of rule-based logic with a logic which is LLM-based. And so you can use a data extractor to see, is a patient frail? Does that mean that you look at the BMI, which is a number? Do you look at the weight change over the last 3 months, which is also numbers, so they're discrete? Or do you look at the notes to see that, the provider wrote the patient is frail or the patient is losing weight? All of those can be elements, and so you can use a little bit of both decision logic that's rule-based and LLM-based to get that the patient is frail. From that, you can either throw it into an LLM to be able to construct your note, or you can use that for decision logic to go down a concrete pathway. And that allows you to really balance between, does it need to be 100% accurate, meaning rule-based pathway, or is it okay if it's 95% there, and you have the ability to check it so that it's almost like a gut check, and if it's not good, then you can fact check. I am Yair Saperstein, and I am passionate about our ability to reduce burnout across not just physicians, but all clinicians by using the tools available to us in a way that empowers us as humans.